give thanks and praise to our Creator, our Heavenly Father, for this opportunity. We are now meeting here in good health and strength in the spirit and in mind. So we welcome you. LBJ has been partnered with Hawaiian Air through our off-island referral program. The history, I believe it goes back to 2012.
2012.
So it's way before we were here. And looking at the numbers, we are very thankful and very grateful for the service that you have provided, not only here in American Samoa, but also for the patients that we need to send off island for the much needed care.
I've been working here for 30 years at the hospital. And during that time as a physician, we've been referring patients through the off-island referral program. And all throughout the years, I've always heard of the help that we get from Hawaiian Airlines. And it's such a great help, and we appreciate everything that you guys have done. I reached out to our off-island department and asked for the data because they did it from 2012. Unfortunately, we don't have the data for the of 2012. We have from 2019, and even that data shows that you guys have continued to help us for over 2,000 patients. But this is just patients. It doesn't include the escort that are included. So the numbers is a lot more, and we are just thankful. Being away from everything, our people rely on the health service of Island, and you guys have contributed by helping us out. People here can't afford. I didn't realize how little the pay is until I've been signing PARs for workers, and I see people with 18, 17, thousand a year, and that is why we appreciate the help that you give us. And there's nothing else I could say that express more. The Samoan words is "fa'aftai telelava," and I guess that's all I can say on behalf of our people is "fa'aftai telelava." Thank you.
Yeah, thank you very much. I'm glad the program is working and is helpful, and I'm glad it's working well for everybody. Thank you for your efforts to administer.
How long, may I ask, the structure that you're currently in now, the facility, how long has it been here?
So the story is JFK was flying on his plane, and they needed a hospital for American Samoa, a meeting place and all that. So this was built during his time. So you see the Lee Auditorium, that was also built during his time for the meeting. The KBCK built during his time.
And you have only one hospital now?
Yes, we only have one hospital. We have our dispensary or our community health centers, which is led by the Department of Health. But this is the only hospital that serves our people here.
And you mentioned a new ER and ICU. You currently have an ER. Is there also an ICU in the current facility?
Yes, we have those services here, but we're looking at improving that for our people. So big projects, and very thankful to the ARPA programs for the federal grants. We're able to get this project going.
Yeah.
So we're looking forward to it.
How about facility modernization is one big area of focus. What are maybe some other challenges that you're facing? Staffing. I know many hospitals obviously struggle for nurses and things of that nature. How is that?
We don't have as many local. So like for the medical staff, I would say 80% of the medical staff are people from off-island. And for the nursing, probably the same amount. We need about 180 to meet the requirement of 1 in 5. Right now, we only have about 100. And so we really need more nursing, more staff, more of everything. You were mentioning the ICU. We have a small ICU. It's a 6-bed ICU, and it's consistently full. So hopefully with the project that we have, we'll have more beds, and we can see and admit more people and try and provide a better care for our people. This old building that you mentioned, it leaks like crazy. And ARPA just helped us out. We're hoping that we'll be able to do the whole roof for the hospital pretty soon.
Next year.
Yeah,
So-
finally.
Most of the funding for the redevelopment were via ARPA funds.
Yes.
Yes.
And we have some local funds that
Okay.
are also putting
Yes.
into these projects. But we're very fortunate for that. So many challenges we're trying to tackle right now. Shortage of medical nursing staff. And of course, you look at facilities, like you said, back in 1968 is when it was constructed. And so we have multiple projects trying to improve some of those areas. Medical equipment, supplies can be a challenge. We are smack in the middle of the Pacific, and sometimes getting things here is a challenge. But we have a good team here who've done this for some time, so things are moving forward. Some of the things that we're challenged with right now, machines like CT scans, we're trying to get that going. Things like that. So,
Yeah. Well, I know that residents come from the University of Hawaii to LBJ. Do you have residents that come from other places? And also, do you just, I think, for the group to learn a little bit more about the residents that come that are brought in, and what that makes up of your doctor population?
Back before, we used to have a lot of residents flying in from Hawaii, consultant from the University of Hawaii that's here for each department. Like if there was one, then the residents can come and work under those people. So that's why it's been difficult trying to get. One of our board member, he's a physician at Queens Medical Center, and he's a surgeon by profession, so he helps us out. Like even with the working on the ER, he communicated with Queens, and we had a Zoom session with the chief of the ER for Queens, and they're giving us recommendation on how to better our service and how to improve. They're even helping us out with our HR. Through that collaboration with Queens, it's been a big help, and we continue to rely on their guidance too.
One of the things that Manako and I get to work with is we work with the John A. Burns School of Medicine.
yes.
And although it's an old relationship, it seems to have been dormant.
Mm-hmm.
And recently we've been having more conversations with them to increase the residents that are going through their cycle of learning and graduation. They have, I guess one of their requirements is they have to serve abroad.
Mm-hmm.
And so oftentimes when you're given the options to go to abroad, Samoa is not always at the top of the list. But recently there were 3 doctors that have come down, residents that have come down. So we're hoping to further develop that or encourage that relationship with that John A. Burns School of Medicine to encourage them to come.
We know it's only a temporarily helpful solution because they come and then they go back. But I think that's something that makes a lot of sense in our own partnership with the University of Hawaii. To be able to, even if it was a steady flow of inconsistent, that you still get people to help, and I think they've told us that they've had reports that people enjoy, I guess, new thought coming in too sometimes. So anyway, we're really honored to support that, and we always think of you folks when we think of Samoa. You're one of the first places that in community and culture relations we think of first. So.
Our relationship with Shriners Hospital as well, they speak fondly of LBJ and the people that you take care of that go back and forth, the children actually, that go for orthopedic surgery and correction and health. So we try to constantly be in front of them as well, asking how we can be of further service.
Shriners, it has been a blessing too. They were here about a month ago. We had a really good visit. They saw so many kids and followed up on a lot of the kids that they did surgeries for. I was telling them because one of my nephew was one of the patients, and he was actually in Hawaii having his procedure, and Dr. Plenter?
Yes.
He had just did the procedure and then he flew here and he was recovering. And now that nephew of mine is back home. So from a personal experience, they're really good, and I'm glad that they're a big help to us, and that we continue our relationship with them. They were saying that they enjoy the trip to American Samoa because our doctors here organize and get all the patients ready, so when they come, they don't waste time trying to find. They just come and see and do procedures, and then they leave. So we hope to have more of those kind of help.
Yeah.
And I'm glad you guys are looking at the John A. Burns for that, especially the residents. And Dr. Peter and I actually spoke of that, of our hope of getting more residents. And he was telling me, man, maybe if I retire and I move down here, then I can have those kids come and work here. You know? So we'll see.
How about the referral program? Sounds like the numbers are solid. How does it work? Is there a variety of different types of patient care that is benefiting from the referral program, or does it tend to be certain types of ailments?
So our referral program, it's so the way we do it is when the doctor sees a patient, they feel that patient warrants to be referred. They bring it in front of our medical executive committee. Medical executive committee consists of all the chiefs of all the different departments. And we hear that case as they present it. And depending on how the case presented, like some cases we'll find that they have an eye condition, but they're also diabetic and high blood pressure. Then the internal medicine doctor will jump in and say, did I see that patient? Did you refer? Is the A1C well controlled? All those questions. Once it's approved by them or denied, then that goes to this young lady here next to us, Katrina. She's with the Hawaiian department, and they review for the qualification if these patients are referred. Now we have two routes, one to Hawaii or the state mainland, and the other to New Zealand. And so we decide which one we can go, and then we refer to that site. We've had a lot that were referred to Hawaii, and when I remember, we've had cases that were because of visa issues, they couldn't go, and they stayed back, and we were having problems with that. Now, the director for Shriner, when he was here, he was telling us, if you have those kind of problems, you reach out to us. We will assist from there. But, it's like Shriner kids. Some of the kids, their parents were born in Apia or Tonga or somewhere, and they have difficulty getting a visa to go to the U.S. So those are like some of the challenges we face.
Can you comment on the top three referrals? Yeah.
So
Reasons for referrals.
primary one is the eye. Ophthalmology leads our referral. And second is cardiovascular. So we have heart disease, heart attack, and I think the strokes, cardiovascular are like the primary ones. And we have urology. We have a lot of kidney stone. As you're aware, we have a lot of gout on this island. So we have a lot of that too. And of course, cancer.
And the referral program works to not only fly them to the treatment in Hawaii or on the continent, but then bring them home when they're able to. Is that right?
Yes.
Yeah.
It's a round trip.
Good.
Yes.
Round trip deal. Yeah.
Can you outline what drives your decision to send somebody to Hawaii or the continental U.S. versus to New Zealand, and what percentage do you think go to each place?
So, well, first of all, before we even consider going off island, we have to find out from the committee if the service can be offered locally.
Mm-hmm.
If it's offered here, we tend to try and treat it here. But if not, then we refer them off island. About how do we determine? A lot of it too is based on the patients. Some people will literally tell us, I don't want to go to New Zealand. I don't have any family in New Zealand. I would prefer to go to Seattle where my cousin or my son stays at.
Yeah.
So that also determines for us where they send.
Insurance.
And insurance too, yes.
Medicaid insurance versus private insurance.
Private insurance.
And Medicaid
Yeah,
can
covers
skew towards
New Zealand.
Right.
I think we hear the same story from all Pacific people at Shriners of the situation where having family there is the crucial point, you know, and being able to. So I cannot imagine what it's like when you're like just trying to tell them, well, you need to get better, and they're saying, no, I don't want to go where my family isn't. I think an understanding of that is super important. So I cannot imagine what those conversations are like.
Yes.
They must be so difficult. I feel like, you know, if it was a similar situation for us, they would say, this is where the doctor is. You guys got to figure it out, you know. But yeah, I just think it's really cool. So thank you for sharing that.
As you're aware, some of the people refuse to go unless they go to where their family is at, or they refuse to go unless their son or someone escorts them. And even though their condition getting worse and worse, they won't unless we figure out a way to get that person on a plane with them.
How many total doctors do you have in the hospital?
So right now we have a total of about 100 doctors.
Oh, wow.
And of those, 20 of those are local doctors. So we rely on a lot of expatriates doctors, you know, that are here. So most of them are on 2-year contracts. But so far we've been pretty good in retaining our doctors. A lot of them re-sign after their 2-year contract.
Good. How about maybe more so for nurses and other medical staff? Do you provide housing for those that are coming from off island to work here?
Yes, so all the medical staff, the doctors, on contract, they're provided we give them a housing allowance. They come in and we have them stay for the hospital provides 3 months. And while they're staying there, we encourage them to find a place to rent. And our office, the CMO office, assists in having them locate a place on island. For nursing, we have some places that are provided for them. We even have transportation too. So we have vans that go drop them off and pick them off. I pick them up afterwards.
Yeah.
And we have people for HR that goes check the places they stay, make sure that they're okay.
Yeah. Good.
Do you have a career path in the high schools encouraging your people to go to med school? I mean, you're
Yes.
fine examples of that.
We're trying to work on that. And I was telling the board during one of our meetings that back in 1985, they had people from here that came and visited the high school and encouraged us to be nurses or doctors. And when I look at the current medical staff, the locals, they're all from the mid-'80s. And even the nurses, it was doing that recruiting. And then there was none after that. So now we're trying to go back, but we're trying to look at going earlier to even to the elementaries and try and get them, encourage them
Plant
to
the seeds
go.
early.
But we also realize that doctors, treating a patient, it's not just being a doctor or nurse. You need people that put the lights on and build the place. So we're encouraging everyone, go into biomed, learn how to fix our CT when it breaks down.
That's
You know,
good.
'cause- yeah.
Sorry, I do want to mention that we also have the Area Health Education Center. I think it's a partnership with UH. And they focus specifically on that, how to get high school students on a career path to healthcare careers. So we've worked with them as well. High schools have invited LBJ and Department of Health when they have school career fairs. So those are some of the ways we've tried to build that pipeline. But some of the challenges we have is, of course, we do produce really good students, and when they are off island to Hawaii or off to the mainland, coming back might be a challenge when they know they can, really further their career out there. So we don't benefit from those right away, Some of them return when it's time to come home to either retire or to take care of mom and dad because of old age. So those are some of the challenges we have. But
Have you guys looked, Hawaii recently passed, Governor Josh Green pushed it really hard of, particularly those, whether they're Native Hawaiian or Pacific Islander, when they go into the medical field, right, they garner a lot of student loan debt. So the Hawaii legislature is putting funds into, right, if you commit to serve to a rural place, right, that we're going to cover your debt. Obviously, I was at the White House last month, and we're seeing more and more of our Pacific Islander students go into fields like medicine, but the barrier often is that student loan. Have you folks been in conversation with other Pacific Islander communities, whether it's Honolulu or on the continent, about some sort of give back program, right? I mean, I'm not sure how it would be funded, but right, if they go to school, right, with a commitment that they're gonna come back here, and for many of them, they are Samoan, they are other Pacific Islander who grew up not here, right, but have the opportunity to not just come home to serve your community, but to serve your own people. I mean, I know there's other kind of advocacy organizations I think are kind of looking at that. But have you folks kind of reached out that way?
as far as reaching out, those are exactly what's on the table for conversation right now. One of the things that we really looked at is providing. We have our scholarship programs with the Office of the Governor. Any students at Camp comes here apply for schooling at the school, Fiji School of Medicine. Through that program, our collaboration with we pay for the entire schooling.
Wow.
And with an agreement that when they're done with all their training, they will come and serve for a period of, I can't say exactly how many years, but they will come and then serve here and continue their training and see if they want to continue on if they want to. It's exciting. We love the work that we do, and we hope that by the time we're done in our appointments, our positions, that we've made some effect. So we're happy to be busy.
Well, you're doing a very important work. So thank you for your efforts and your leadership.
Well, thank you to CEO and your corporate team here. Without the services that you're providing and the benefit through our corporate account, it would be very challenging for us to send some of the patients that really need the services that need from off island, with the budget that we have. So our thanks go to you, Taina.
Well, this is a good program. It sort of makes you wonder if there's other areas that we could be helpful. And thinking about this conversation about the ties to UH and potentially bringing docs down or bringing people down to talk to kids in schools about medical professions. If there are things like that where we could be of assistance, even beyond the referral program, please let us know.
Definitely will. And I think that's one of the things we really want to enhance here at LBJ is exactly that, bringing in physicians and sharing of knowledge, and even sending our physicians to learn.
Sure.
Sort of like an exchange program of some sort. So he's going to be a busy man.
Well, this has been great. Thanks for it's like an important part of our trip here is to learn, and this is the important learning for us. So thank you for sharing.
Our pleasure. I would like to take this opportunity to once again say thank you for taking the time to come here and speaking with me and the ACEO and our off-island referral program. We are very fortunate, and we're very happy to have our relationship and to continue so that we are serving our people here through Hawaiian Air so that they can get to where they need to get the most the services that they need. So fa'afetai te lilofa. Thank you.
Thank you.